From WRAL News and the Capital Broadcasting Podcast Network, this is the Coronavirus North Carolina News Brief for Friday, October 1st. I'm Mark Boyle. The start of the new month brings more optimism on the COVID metrics in our state. On Thursday, the state reported fewer than 3,000 hospitalizations statewide for the first time since August 17th. The positivity rate also dropped to the lowest number we've seen since mid-July at just under 8%, still above the 5% threshold where the state health officials would like to see it. On the vaccination front, this week the CDC issued an urgent alert for pregnant women to get the COVID vaccine. New data from the CDC shows more than 160 expectant mothers have died from COVID, 22 of them in the last month. WRAL's Leslie Moreno has more on the new warning for expectant mothers.
Anything dealing with a mother and a baby is a difficult decision.
I totally get it. You don't really think about how scary it can be, scary it is of a decision it can be until you become a parent.
Lauren Schneider was pregnant when she decided to get her COVID vaccine. She gave birth to a healthy baby girl in May, but she admits she had questions too.
There's only so much data, and there's a lot of hysteria and a lot of misinformation.
New CDC data shows symptomatic pregnant women are at a higher risk of ICU admission and have a higher chance of death than those who are vaccinated. The risk is not just to the mother. COVID in pregnancy can cause preterm birth and stillbirth.
Definitely, we've seen individuals who are not vaccinated have complications that keep them in the ICU, put them on the ventilator, require us to deliver their baby early.
According to the CDC, as of September 27th, there have been more than 125,000 confirmed COVID cases among pregnant women, 22,000 hospitalized cases, and 161 deaths.
It's been given to over 161,000 pregnant women. We have not found any indication of increased risk of miscarriage, stillbirth, premature labor.
She says fear is a major driver in unvaccinated pregnant women, something all mothers can relate to.
Be sure to subscribe to this podcast, which is updated on Mondays, Wednesdays, and Fridays. On Monday, we'll have a conversation with a local pharmaceutical CEO about the next phases of the pandemic. For the Coronavirus North Carolina News Brief, I'm Mark Boyle.